All right, I think we're gonna get started. I'm sure more people will keep joining as we get going. But welcome everyone to HCP's online webinar for October, titled Spooky Tales: Learning from HIPAA Audits. We have a great presentation today by Nicole Statley, and I have the privilege of introducing her and reading her bio. Nicole Statley has spent the last 19 years in the healthcare management industry. She has been involved in a little bit of everything, including clearinghouse management, medical billing, coding, auditing, and compliance. She currently has certified professional certificates in compliance, medical auditing, and coding. She is passionate about helping organizations to not only be compliant, but to feel supported in their compliance efforts. And with that, I'll pass it over to you, Nicole.
All right, awesome. Thank you, Josie. Today I'll be telling you some spooky tales, but hopefully you won't leave here with nightmares, but instead with some practical tools for being prepared for an OCR HIPAA audit. So, what is an OCR HIPAA audit? They are audits conducted by the Office of Civil Rights, which is what OCR stands for. They are an official review to determine whether a healthcare organization, covered entity, or business associate, basically anyone that has to follow HIPAA, making sure that they are actually compliant with all HIPAA regulations. The goal normally of these audits is to ensure compliance with HIPAA. HIPAA is kind of broken down into several areas, but a lot of times these audits focus on privacy, security, and the breach notification rules. These audits can serve multiple purposes for the OCR, but one of their purposes is to monitor and address best practices and compliance risks related to PHI. So sometimes these audits could lead to, fines and some sort of enforcement action, but sometimes the audits are really just for the OCR to gather data and figure out, what are people currently doing. It helps them build what their best practices might be based on industry risk. So they can kind of serve multiple purposes. So today I'm going to dive into the two main types of HIPAA audits. So one of those is audits that stem from a complaint or a breach, and the other one are just random HIPAA audits that the OCR conducts. So first, we're going to start with the complaint and breach-driven audits. All right. So OCR HIPAA audits, complaint and breach driven. It is estimated, this number was actually kind of shocking to me, but it is estimated that the OCR receives around 30,000 HIPAA related complaints every year. So a lot of those complaints are going to be coming from patients, coming from individuals, maybe within organizations. These are not necessarily breach related. They could end in a breach or they maybe were part of a breach, but these are people going onto OCR's website and lodging a complaint. So obviously with 30,000 complaints a year, they can't investigate every single complaint, but they choose them, which ones they're going to investigate based on, some certain criteria. The seriousness, of the allegations is obviously going to be important, and if in fact there was a violation of HIPAA. So as we know, sometimes patients or individuals might think that HIPAA is being violated, but it actually isn't. So they aren't necessarily going to investigate those unless from, the information given by the individual that there's a high likelihood that HIPAA was breached. So outside of those direct complaints, often investigations can stem from actual breaches. Those breaches could be self-reported. So your organization could self-report, and then obviously OCR is going to look into how that breach occurred. Or it could be through a whistleblower. So those breaches oftentimes do come from whistleblowers. They come from someone within the organization who discovers a breach, and maybe the organization wasn't planning on reporting it to OCR, but the whistleblower does it on their behalf. Any breaches that involve 500 or more individuals, so 500 and more patients or records, all of those are automatically investigated by the OCR. However, the OCR can and will investigate any breach it chooses. It does not have to meet that 500 individual threshold, and you'll see that in a couple of the examples I'm going to give today, that number isn't always a guarantee. So if you have a breach and you're like, oh, it was only 100 individuals, OCR is probably not going to investigate it. I would never assume that. The OCR can really choose to investigate any sort of complaint or breach that it chooses. All right, so our first two spooky tales. These tales are unfortunately common mistakes that lead to nightmares for all involved. So first up, we have Cadia Healthcare, a tale of good intentions gone wrong. Once upon a time, in the not so distant past, 2021 to be exact, the OCR received a chilling complaint that Cadia Healthcare had posted personal health information on their website and social media without the patient's consent. The OCR launched an audit and investigation and discovered several frightening truths. Cadia had indeed posted the success stories of 150 patients, which included their names, photographs, and information concerning their condition, treatment, and recovery. But surely Cadia received the proper authorizations, the investigators may have asked themselves, but to their shock, no such authorization had been obtained. What could this grievous act, how could this grievous act have occurred? Well, I'm sad to tell you that Cadia's compliance program had many deficiencies. Exhibit A. Cadia had either non-existent or lackluster HIPAA compliance policies. The policies they did have may have been collecting dust and cobwebs, rendering them ineffective. Exhibit B. Cadia had no designated privacy officer. Exhibit C. This one should scare you. Their marketing team appears to have had no HIPAA training. Exhibit D. No notification to the affected patients was made. So this truly is a tale of good intentions gone wrong. Media set out to share patient success stories, which should have brought hope and healing. Instead, they conjured up a HIPAA breach and a $182,000 fine. In this digital age, it is imperative that your compliance program is established and effective. A lot of emphasis on that effective side. In this case, if their marketing team had maybe done some training on HIPAA, or if there had been strong policies and procedures in place for how to handle PHI, then it's very possible that this outcome could have been avoided. I ask you to heed this warning, or you may find yourself chasing away the ghosts of HIPAA breaches. Next up, we have Yakima Valley Memorial Hospital. In a quaint town nestled in the Yakima Valley of Washington, known for wine and apple orchards, we find our next spooky tale. Like any normal hospital, halls of Yakima Valley are often filled with all sorts of people, from patients to cleaning crews to loved ones to security guards. Nothing seems amiss at first glance. But in 2018, a grievous act was taking place. Lurking the hallways were 23 security guards who were snooping on the electronic medical records of 419 patients. To the shock of investigators, these security guards had credentials to access all sorts of protected health information. But wait, shouldn't access to PHI only be given to those who need it to complete their job duties? Yes, it is a direct violation of the HIPAA and privacy security rule for unauthorized persons to have access to PHI. The horrors continued when the OCR discovered that widespread snooping was occurring by the hospital staff. This nonprofit had to fork over $240,000 and be monitored by OCR for 2 years because of the snooping. But how did this occur? What allowed this snooping to take place? Exhibit A. Security guards had access to PHI. Now, this one can get tricky. There may be a reason a security guard needs to access PHI, right? So, for example, to verify the identity of a person, maybe a visitor coming to see a patient, or in an emergency situation. But what is probably not needed is access to a patient's full medical record. This is a great example of not meeting the minimum necessary standard required by HIPAA for access to PHI. If you've been around us in HCP for any amount of time, You know that this is one that we talk about over and over. Access controls, having those in place, making sure the only people who are authorized to have access to each individual part of a system have that access. Exhibit B. The fact that widespread snooping was occurring tells us a couple of things. One, multiple staff members may have had access to more than they needed to complete their jobs. And two, that staff may have been unaware of what is allowed and not allowed when it comes to accessing PHI. I once had an office manager tell me that because they're the office manager, they can access any PHI they want. Okay, that may be true, but you can still only access PHI necessary to do your job. That does not ever give you free reign to access PHI. You must always have a legitimate reason to access any sort of PHI, medical records, any of that. Exhibit C. OCR discovered the chilling detail that Yakima Valley did not have sufficient policies, procedures, or training for staff. So when your foundation is shaky, it's no wonder that things begin to crumble. Policies and procedures really do set that baseline, that foundation, and then everything else within your compliance program should really be built, on top of those policies and procedures as the foundation. So these two examples I've given you, maybe a little silly to tell them in a story like that, but these two examples are complaint driven. Okay, so these were audits that the OCR conducted because someone complained. Someone said, hey, this is happening and this shouldn't be happening. With the one with social media or their website, it could be that a patient or a patient's family member saw their life story, on this website and commented on it. And then the patient was obviously maybe surprised that their information was out there for the world to see. And then in the second example, a tale of failed access controls, it's just that, it's something that didn't need to occur, and maybe with some proper training and helping staff to understand really what HIPAA allows and doesn't allow when it comes to access to PHI is super, super important. All right, so now we're going to kind of shift gears into the non-complaint driven HIPAA audits. So what prompts these audits? How does OCR decide who they're going to audit when they randomly decide to audit somebody? So the first one up is really just random selection. So the OCR can reach out for an audit randomly to a covered entity or business associate. As I said before, basically anyone who is subject to HIPAA regulations can get audited by the OCR. Another way that the OCR might conduct one of these audits or decide who's going to get audited is they sometimes send out questionnaires just randomly to covered entities or business associates. And then from the information they gather from those questionnaires, they'll decide if you are going to get included into their audit pool for that audit that they're conducting. Another way that they can decide this is based on risk. So the OCR might select organizations that fit into a higher risk category or based on current enforcement action or activity, which I think is something that we're seeing more and more. For example, with the high rise in data breaches, some of those might trigger an audit. If you are in an industry, which we all are in healthcare, that is seeing a significant increase in cyber attacks, if your organization has a cyber attack, I would expect an OCR audit to also accompany that. And then the last one, which we kind of touched on, is just specific events or complaints. So if a larger breach occurs or an organization has received multiple HIPAA complaints, the OCR might add that entity into the audit pool. So let's say you have one patient, lodge a HIPAA complaint on OCR. They might, not look into that if it's a minor thing. But if you start having multiple patients or multiple people within your organization complaining that that HIPAA is being violated, that might be a red flag where OCR is going to say, hey, we need to look into this organization. All right, so there also is organized audits that the OCR is conducting. These are required by HITECH, which was enacted in 2009. So this actually requires HHS to conduct periodic HIPAA audits. Phase 1 already happened in 2011 and 2012. Phase 2 was in 2016, and phase 3 is actually currently taking place. So I'm going to talk a little bit about phase 2 today. And phase 2 did happen in 2016, and the report was available in 2020. I think looking back, even though, now the report is 5 years old, and I'll kind of talk about that a little bit later, I think it's important to see, who is the OCR looking at when they decide to do one of these audits that are part of their phased audits required by high tech, who are they going after? I think it's really interesting if you look under the healthcare providers. I think some people would assume, okay, they're going to go after, and when I say go after, they're not always looking for someone to fail, right? They're obviously hoping that organizations are following everything with HIPAA. But these are the people that they've decided, organizations they've decided probably might have higher risk areas. And so these are, in larger amounts who they're going to audit. So for example, at least in this case, it wasn't hospitals, it was individual practitioners. That was over half of the healthcare providers that they decided to audit. And then on the business associate side, it's billings and claims. So RCM, actual EHR, so electronic health records. And then you kind of see as the numbers kind of dwindle down, at least on the business associate side, it might be people that, okay, are handling PHI, but maybe, not as much as, say, a billing and claims company. So I think it's interesting to look at to see how or who they decided to actually audit. They did audit about 166 covered entities and 41 business associates. So the audit was heavier on the covered entity side, but they are adding business associates, and I will be interested to see phase 3 once that information comes out. I wouldn't be surprised if there's more business associates added to that pool. So phase 2 focused on the privacy rule and the breach notification rule and the security rule. So kind of what I talked about, it's kind of some pillars of HIPAA that they're always going to want to ask questions about. So we're going to talk about some of those audit findings, and I think they're important to look at because they're things that haven't gone away, right? So still in 2025, all of these things are still 100% relevant, and I think it's good to look at this and see, okay, if you would have been audited and they were looking at these things, within your practice or organization, how would you have fared? All right, so another chilling tale. The audit began, documents were requested, and failures were uncovered. The results showed a spooky truth that a document as common as the Notice of Privacy Practices may not be meeting HIPAA requirements for a large majority of covered entities. In fact, only 2% of covered entities fully met the requirements concerning content of the Notice of Privacy Practices. Many entities did not meet the requirement to provide a notice that is written in plain language. This audit element did have a positive note. 57% of covered entities did post their NPP in a prominent location and properly on their website for patient access. So, Notice of Privacy Practices, it's a super common document. You definitely should have one if you're a provider, if you have a practice, a clinic, a hospital. It is a requirement of HIPAA. Now, just having it doesn't necessarily mean that you are meeting all of the requirements, right? So there's a couple of things in the HIPAA regulations that it states. What they did in this audit is they basically requested a copy of it. They wanted to see, all right, what does your notice of privacy practice look like? And they wanted to see, where is it posted? Is it posted in your facility? Is it posted on your website? And what they did find was that only, skipped ahead, with the only 2% were actually, following all of the requirements. A lot of that had to do with the NPP being written in common language. So I think sometimes with these types of documents, we get very legally, we want to make sure that the legal requirements are being met. And so sometimes the language is over a lot of people's heads, right? It doesn't make sense. They don't actually really know what they're reading. We know that probably patients aren't necessarily reading the Notice of Privacy Practices, even though they should. But if they do, and if they should, we want to make sure it's written in language that they can understand, and that isn't so riddled with legal terms that they don't actually know what they're reading. All right, next up, audit findings, right of access. This is a big one. In the darkest corners of healthcare compliance, we find a story of covered entities failing to honor patients' individual rights to access their own medical records. Patients often find themselves trapped in bureaucratic labyrinths and unable to retrieve their data within the 30-day window required by law. As the shadows lurk, covered entities may find themselves penalized for this failure. Consequences are grave and monetary wise range from $3,500 to hundreds of thousands of dollars. There have been whispers in the night that the 30-day window may shrink to 15 days, so stay alert and be prepared. So, right of access. The HIPAA privacy rule requires entities to provide individuals, upon request, access to PHI about them in the form and format or equivalent format requested by the individual. Covered entities must implement policies and procedures to enable these rights. So in this audit, the OCR evaluated the documented policies and procedures of covered entities, as well as the documentation of their responses to any of the requests. So, right, when you think of audit, usually they're going to look for some sort of audit trail. When did the patient make that request? Within how many days did you at least respond to the request? And then within how many days did you actually produce what the patient was asking for? So in this case, 89%, which is to me a very large number, 89% of covered entities failed to correctly implement the individual right to access their health data. So several factors came into play here. They had inadequate documentation of access requests. So the patient might have, called and requested the access. There was no notes in the account. You have no idea of when the request was actually made and when the request was met. There was no documentation of how they responded. They also had a lack of policies around the timeline requirements. That timeline requirement is so, so important. You can get fined if you go past that 30 days. Now there is, an extension protocol that gives you a little bit more time, that you have to really have a legitimate reason for using that. If you go past that timeline and a patient complains, you could be fined because that is their right. It is their information, and you do have to give it to them within the required window. The other thing, besides just timelines, is having policies around the cost. So I think sometimes there's misconceptions out there that you can charge a patient for requesting access to their medical records. There is some cost that you can charge for. What you cannot charge for is searching for the records, retrieving the records, or any sort of overhead costs. The costs must be things that are more tangible, like copying costs. So if they ask for their medical records in paper, the amount of ink or whatever the cost is to provide those supplies. Let's say they want something mailed to them, the postage that you put on that package, that is something that you can charge them for. But they must be reasonable. They must be clear costs. So now you might be thinking, who's asking for paper records anymore, right? Everything is digital. So the costs might not be super relevant anymore because a lot of EHRs, EMRs, have a patient portal. However, if a patient does not want to use the portal and they request their medical records in a paper format, this must be accommodated if it's possible. I know most EHRs, EMRs, you can print things. If you can print it to a PDF, something like that, and they want it printed, you must make every reasonable effort to accommodate how the patient wants to receive their information. So it is a violation of their right of access if your response is just go on the portal and the patient says, I don't know how to use the portal, I don't want to use the portal. And if you don't give them another option for how to receive their medical records, that is a violation to their rights. All right, next up, audit findings, security risk analysis. Now, this one is going to apply to covered entities and business associates. So both covered entities and business associates are required to complete an accurate and thorough security risk analysis. So let's see what this audit uncovered. Lurking around the corner was what everyone feared: the giant, complicated, often ruthless security risk analysis. Many have wrongly assumed that compliance to the security risk analysis is a mere compliance formality. Unfortunately, this is not the case, and covered entities and business associates alike have fallen prey to the lurking cyber threats and vulnerabilities that were roaming undetected. The only way to conquer this beast is to meet it head on and mitigate the risks identified. Many have tried to run from it and have failed. Those who have conquered it have found freedom and comfort in knowing they have met this important HIPAA requirement. So, as I said, if you're a covered entity, business associate, if you are subject to HIPAA, you must complete a security risk analysis. So, what this audit did is they asked for evidence of a completed SRA and the policies and procedures to support the assessment. So policies and procedures around, number one, conducting it. And number two, what are we going to do with it once we have conducted it? What are we going to do with that information? Unfortunately, only 14% of covered entities and 17% of business associates had properly conducted an SRA. Additionally, they failed to identify and assess the risks to all of their EPHI in their possession. So let's just say they didn't complete an SRA, but they had other policies, strong policies and procedures around, taking care of EPHI, making sure that the risks are being mitigated. They didn't really find much. So no policies and procedures around any of the things that an SRA would have helped them uncover. There also is failure to assess the potential likelihood and impact of risk to EPHI. A thorough SRA will have several risk areas to be assessed. So that's an important thing is, your security risk analysis should really be thorough. It should really have, some sort of matrix, some sort of low probability to high probability, low risk to high risk, some sort of metrics in there that are helping you identify low risk areas within your organization and high. And then if those things were to happen, what type of impact they would have on your organization. Again, if you've been around HCP for any amount of time, we talk about the SRA a lot. We love talking about it. It is one of the first things we will tell you to do in the compliance program world is to, conduct that analysis. So, for example, one of the likelihoods or impact things that, might be on an SRA is say like a phishing email. It might ask you to think and evaluate, if what is the likelihood that your organization would receive a phishing email? Okay, I would say nowadays that might have been low in the past, but I would have even marked that at a medium or even high of the likelihood of it happening. And then you go on and assess, okay, if that did happen, if one of our employees received a phishing email and they clicked on it and it caused some sort of a breach or a virus, what impact would that have on our organization? Would it be a low impact, medium, high? So those are the kinds of things that it's going to ask you to evaluate. And they're very important because then it helps you to not only strengthen your policies and procedures, but even think about things like training. Like, okay, if phishing emails, phishing attacks are a high risk to us, then we should probably have some sort of training for our staff to know how to handle phishing emails or how to identify them. So then there were some that maybe conducted an SRA, it was insufficient. And then there was plenty within this audit who just hadn't even touched an SRA before. They had no SRA, which also then led to them having no risk management, no security risk management program. So the risk management standard requires implementation of security measures that reduce risks. So the OCR wanted policies and procedures that show that, okay, we have all these risks, and here are policies and procedures for how we lessen the risk, mitigate the risk. But most covered entities and business associates were unable to provide that proof. And then normally from an SRA, you're able to develop a risk management plan. So this helps, again, identify the risks that were figured out within the SRA, and then the plan to manage those risks. You might not ever be able to bring your risks all down to low and zero, but you need to have something in place to keep them at bay as much as possible. All right, so OCR HIPAA Audits Phase 3. So I'm super excited to see, probably in a couple of years by the time we get the report, but to see what these audits cover, new things that are discovered. So this third phase by OCR, it began in December of 2024. OCR has indicated that this third phase is focused on the HIPAA security rule specifically. So this is in light of the dramatic increases in cybersecurity attacks. So this is kind of what I was talking about before, when special events or things, are happening in our industry, OCR is paying attention to those things. And those are then the things that they're going to say, hey, we need to audit, within this space because this is now a problem. Um, Cyber attacks, big problem. Between 2020 and 2024, hacking incidents increased by 30%. And there was a 45% increase in ransomware attacks just within the healthcare industry. In fact, and this number was crazy to me, 81% of all data breaches reported to OCR last year were due to hacking. So we won't know again what specific areas are in these audits, but our guess is a deep dive into the security risk analysis. I would expect them to look at every point within that thing and want to see your policies and procedures, your training, your risk management, cybersecurity measures, cyber liability insurance, anything really around electronic PHI and how you are safeguarding it. I would expect that that is going to be huge in this audit. So, given our continued reliance on technology and the quick adoption of AI and the rising threat, it is safe to assume that the OCR will continue to focus on these compliance requirements. These are not going away. I'm sure you've heard about the possibility of the strengthening of the HIPAA security rule. That obviously this year has kind of been put on the back burner. It was supposed to go into effect, I believe, in July. Who knows what's going to happen with it. But I think no matter what, it shows that there is a strong realization within the government, within OCR, HHS, that we rely a ton on technology, and especially within the healthcare space. New vendors, new things are popping up all the time to hopefully make our jobs easier and to be able to provide better care to patients. But there's a risk with that, right? And if we don't have the proper things in place, the cyber attacks, all of that is just going to go up. So OCR has really focused on that. Even almost every enforcement action that I've seen posted this year by OCR has cited a lack of a security risk analysis or other related security measures as one of the main factors that led to that organization having a breach. All right. So now that I maybe have terrified you and made you, maybe freak out a little bit about some of your compliance efforts or maybe some weak areas in your compliance program, hopefully now I can give you some tools and things to help you. So surviving the audit nightmare. So why did we look back? Why did we look back at a report from 2020 for audit conducted in 2016? Audits at this point are almost a decade old. Part of that is, and I think that information is still super valuable, is because most of the elements in HIPAA have not changed. Any changes that have been made have only strengthened the law, not weakened it. What the OCR was looking for in 2016 will still be the same as today, plus more. They're just going to add to it, and they're going to be looking for more things. The 2016 audits and the current cyber landscape that we've been talking about helped shape the current audits, right? So OCR was like, oh, there's a lot of cyber attacks happening. We really need to focus in on the HIPAA security rule. And so that's shaping their audits, that's shaping the enforcement actions. And I think that will continue to shape the things that they are focused on. So what can we do to survive an audit, right? What can you do now to prepare if the OCR ever comes knocking? And beyond that, remember that compliance is not optional. Even if you never get audited, you might be thinking, okay, they only audited, less than 200 covered entities last time, less than 50 business associates. So it's never going to happen to me. So do I really need to care about this because the likelihood of me being audited is so low? Yes, you still have to think about it because if you are subject to HIPAA, all of these things still must be in place. They're really not optional. All right, so let me see if I can help you. Let's make sure you are always audit ready. Survival guide, right? When most hear the word audit, it usually brings on nightmares and apocalyptic reactions. But I'm here to tell you it's not the end of the world if you're properly prepared. So here are some quick survival guide, key areas that you should have established and effective and documented within your organization. So again, established is one thing. You have a compliance program, you have policies and procedures. If they are two things, not effective or not formally documented, it's basically like you don't have anything. I will say, some of the things that I've read with the OCR or when breaches occur is a lot of times organizations are like, hey, we have policies. Hey, we have our staff does some training. Um, that starts to fall apart when they start being asked questions about those policies and procedures, right? Like, okay, how effective is this policy? Is this procedure actually taking place? Do staff even know that these policies exist? So, number one of your survival guide, policies and procedures. You need to take a deep dive into your policies and procedures. You need to have formal policies and procedures that are actually being utilized. If they're not being utilized, maybe it's not even needed. Maybe you have a stack of, 100, 150 policies and you find out that, oh my goodness, we actually could probably only have, 70 policies and this would cover everything that we need to cover. These policies, and again, policies and procedures, you probably have ton for your organization. I'm specifically talking about HIPAA related in this webinar. So these policies should cover HIPAA privacy, HIPAA security, as well as breach investigations and notification processes, right? So looking into HIPAA privacy, what does HIPAA privacy require of us as organizations? What does the HIPAA security rule require? And then breach investigations. If there is a breach, what do I do? What are the protocols? They are spelled out, and you should have policies within your organization that are following the procedures that are required by OCR. Um, I often hear clients tell me that they have a process in place, but it's not written down, and one person on the team just takes care of it. That's my favorite thing, and I was joking with a client actually the other day because their IT guy just kept saying, "Oh, it's a people process. I don't have it written down, but it's in my head, and a person takes care of it." And I was like, "Okay, that's great. That's a start. It's good that someone is taking care of things like access control and making sure that only the right people have access to things." Now, the second step is let's write that down. Let's make that a formal process. It is really important that more than one person is aware of these policies and procedures. What happens if that person leaves the company and now you have no clue how to manage the access to PHI within your company because that person just had all of that information just in their head and it wasn't written down anywhere. Um, on top of that, I highly doubt that the OCR will accept a verbal policy. So when they conduct these audits, and they ask for policies and procedures, there is a time where a dialogue time where they're allowed to ask questions. You're allowed to, maybe give some insight or more details into certain things. But if they don't have something tangible in their hands, they're not going to accept just a verbal policy. You're not going to be able to just say, oh, well, Joe, he's our IT guy and he just takes care of it. That's not going to be a sufficient answer. So policies and procedures, I would start there. Next thing I would do, maybe even in tandem with developing policies and procedures or with that deep dive, is completing a security risk analysis. Now, there are other risk assessments, out there that might be helpful for your organization, depending on your specialty, what your organization does. But a thorough security risk analysis might actually help you develop some of those policies and procedures. They'll help you kind of see where improvements need to be made. But it is imperative that you complete a thorough security risk analysis. This assessment should go through each of the safeguards required by the HIPAA security rule. The majority, again, as I said, of enforcement actions that the OCR has said that lack of security risk analysis was a huge factor in the breach and also a huge factor in the fine. If you do not have these things in place, they do not necessarily look as kindly on you when you do have a breach occur. Next is a risk management plan. Get that thing in place. Now, you can't really get that in place until you've probably done your policies and procedures and security risk analysis, because those things are going to help you develop that plan, right? And that plan should identify any risks that are discovered and outline some sort of either corrective action or mitigation steps that need to take place. I say this, anytime I talk to a client about the security risk analysis, is it should your risk management plan and really your security risk analysis, those two things together, should be a living, breathing thing. It's not a check it off the list. We did our SRA. Oh, we have a risk management plan. It sits over here kind of on my desk, and I don't really look at it very often. It should be something that's active, right? It's constantly evaluated throughout the year. It's monitored for progress. Now, with that said, you might need to have someone that is in charge of that process, which we'll talk about in a little bit as well. Training. Training is so important. Probably nobody likes taking it, besides maybe all of us at HCP, because we're compliance nerds. And so we love learning about compliance and talking about compliance. But outside of us, there's probably not very many people who look forward to their compliance training every year. You should look at your training. If you're not doing it, then you should be doing it. Number two, if you have training, it might be a good time to look at it and say, okay, is this even still relevant? How long have we been using still this same training from, say 20 years ago? Is it, does it even have any of the current regulations in place? It's good to look at that. Your staff should be trained in several areas. The ones I'm focused on today are HIPAA and cybersecurity, just in light of the audits and light of what OCR is looking for. HIPAA is a no-brainer to me. Cybersecurity, I would strongly encourage cybersecurity training. Again, with what I said, that most of the breaches from last year occurred due to hacking. A lot of times that hacking is coming through things like phishing emails. If your staff doesn't know how to identify a phishing email, that is a high risk area for your organization. So this training should be relevant, as I said, and it should be trackable. So again, if the OCR were to audit you and you say, oh yeah, our staff, does training, but you're not able to provide them with some sort of report on dates that training was completed or how often training is happening, they're kind of going to look at you and be like, okay, how do we prove this? It's always within our industry, within the healthcare industry, when we talk about coding and billing, what do we always say? Like, documentation is king, right? If it's not documented, it didn't happen. Well, the same still applies here. It applies with the OCR as well. If it's not documented, to them, it really didn't happen. If your training isn't documented, it didn't happen. If your policies and procedures aren't documented, they don't exist. If your risk assessment wasn't documented, it never happened. So keep that same line of thought that you do when you think about creating an encounter for your patient or having to code or bill, is that you are basing everything for the most part off of that documentation. And that's what the OCR is going to look for as well. Next up is vendor management. This one I've started talking about a lot more because I see that this might just be a weak area that everyone can probably improve on. Um, if you are using a third party for anything, that vendor should be properly vetted. Their compliance program, their policies should be evaluated. You should have a BAA in place. I've started to see some more enforcement actions and just conversation around the OCR, not only looking into covered entities, but then they want to see, okay, well, who else is touching the PHI within your organization? Do you have a medical billing company that's working with you? Do you have an IT company that you outsource things to? Any of those type of vendors, they want to know that you are managing those vendors, that you are vetting those vendors, that you have a BAA in place, because ultimately you're still responsible for that PHI. You're the originator of it, you're the source of it. They want to know that you are putting things in place to make sure that anyone else who touches that PHI on your behalf is also following the rules. All right, next up is an EPHI inventory list, an asset list. This is another thing that I keep seeing pop up all over the place. OCR wants to know that you know where all of your PHI is at all times. They want to know how many laptops are you using, where are those laptops located, who has access to those laptops. They want to know desktops, they want to know servers, they want to know software, they want to know tablets, they want to know cell phones, basically any device or software server that is either accessing PHI, storing it, sending it, anything related to that. You need to have a inventory list that again is an active list that is being kept up to date so that you can easily, readily prove, yep, here's everything that accesses our PHI. Here is who has ownership over that device. And here's how we're tracking it. Here's what we're doing with it. If it becomes obsolete, it's still on the list because we need to know where all of our PHI is. Last one for the survival guide is a little bit of a bigger one. Excuse me. It's the contingency plan. So, a contingency plan, now this would be part in theory of your policies and procedures, but I think it deserves its own mention. This includes your data backup plan, your disaster recovery plan, and your emergency mode operation plan. So those three plans are kind of wrapped up into this one plan called the contingency plan. The data backup plan includes your procedures for creating and maintaining exact copies of ePHI so that data is not lost in an emergency or a system failure or a cyber attack, right? So let's say you have a ransomware attack when you need to be able to get that data back quickly. The disaster recovery plan provides the steps for restoring lost ePHI following a disruption. And the emergency mode operation plan provides the procedures for keeping critical business functions running that use ePHI during a crisis. So, what happens if you have a provider who's in the middle of a surgery and all of the systems crash? Do you have a plan in place for getting systems back up? That's super important. All right. So there's your survival guide. It is not necessarily all encompassing. I am pointing out what I have seen and just industry wide best practices of these things should be in place. There's probably others, and you always need to evaluate your specific business to see, what additional things you would need. All right. Last thing up is resurrecting your compliance program from the dead. So, after all these scary tales, if you find yourself concerned, maybe you just need to resurrect your compliance program from the dead. Maybe you have policies and procedures, but they're collecting dust. And maybe you haven't even conducted a security risk analysis ever or recently. Not to fear. The zombie apocalypse has not happened yet. So there is still time not only to survive HIPAA compliance, but to thrive in it. So here's some practical ways to breathe life back into your compliance program. Number one, internal audit. Take a look at your program, take a look at your organization, really look and see, do we have these things in place? And if we do, are they effective? Are they actually working? Is anybody listening to our policies and procedures? It's just a great place to start. Get that litmus test, kind of just figure out where you're at and what things need to be worked on. Maybe there's some things that you're doing really, really well. And so you can kind of check those off the list and, maybe focus on higher risk areas. Take a deep dive. Really just try to figure out where you're at. Again, I'll say it again. I'll say it 100 times, and I'll probably say it in every single webinar that I ever do. You need to conduct a security risk analysis. If you've never done it, do it. If you haven't done it and recently, I would conduct one again. So many things can be discovered through this assessment, and that'll help you again know where to start. Sometimes it can be hard. Most clients that I deal with when they get started, especially if they don't have a lot of compliance already kind of built up in their company, is they feel very overwhelmed. They're like, this is actually a lot. When you start to take a deep dive into HIPAA, there is a lot in there and a lot is expected of you. That is just the industry that we are in. So conduct that security risk analysis. That'll help jumpstart things and help you figure out where you need to go. Training. Evaluate your current training and implement training. Again, is it relevant? Is it kept up to date? Are you logging completion of it? Do your staff like the training? Now, they don't need to necessarily like it, but there are some pretty good trainings out there that are a little bit more interactive or, even just visually a little more appealing. I was even laughing with my husband the other night because he was watching me create this webinar and he's like, oh, okay, Halloween themed. And I was like, yeah, I'm like, honestly, it's a little more exciting than just like our normal. And I showed him just our HCP colors, which I love our colors because green's my favorite color. But compared to Halloween theme, it felt a little boring, And so even just little things like that within training, having, imaging and really good examples or stories, sometimes that can help and that can make the training process a little less painful for your staff. Last thing I'll mention, and this one obviously is hard to measure, but create a culture of compliance. Is there buy-in from the top down? If the leaders in your organization are not actively involved in maintaining compliance, it is unlikely that the rest of your employees are going to. Okay, sometimes compliance efforts can get put on the back burner due to program costs. And in fact, it's not a line item usually on everyone's revenue spreadsheet. So when you're looking at revenue for the year, compliance isn't probably bringing in anything. And so I think sometimes it gets put on the back burner because it's actually ends up in the expense column. However, I was in a webinar recently where the speaker described compliance as an invisible return on investment. And I just really love that because I think that's so true. Compliance is an investment into your company that may not always be quantifiable, but protects your business from costly fines, expensive breaches, and loss of reputation. It doesn't hurt that it also makes your company look good, right? To have a robust, effective compliance program. The clients that I work with, when they go through our system and they get all of these things in place, they really do have a renewed sense of confidence that, okay, I think we're actually doing some things right, and we have all these things in place. We've built this foundation, and it just gives more confidence into their compliance efforts. Last thing I'll mention is within that culture of compliance is you should have a compliance officer. Okay, look at your team, see if there's someone who can champion this role. If your organization is small, then this might mean it's someone that can maybe wear multiple hats. So you might not be able to have a full-time compliance officer, but you don't always need one, especially once you get your program established and it's up and running. It could be that it's someone who does multiple things. So that's my last piece of advice. I do have some resources that we will send to you. So this tells you the phase 2 audit report, that full report. So if you are a compliance nerd like all of us here, you might find that report fascinating. I have some resources to help you with your notice of privacy practices, to help with the records request process, the security risk analysis. And then the last thing on here is just the OIG's general compliance program guidance, which was updated recently and is so much better than it was before, and really does help you to kind of hit all of those points that the OIG would expect from your compliance program. I will say 2 of the websites that I have on here were technically down due to the government shutdown, but I kept them on there because as soon as the government's all back up and running, then you should be able to access those resources for help with records requests. With that, I will see, Jake, do we have anything in the Q&A?
Yeah, we had one question that we already answered. Great question, though, from Caitlin that said, what do you say to covered entities who say they don't need to include all hardware in their asset inventory because the hardware does not directly access EPHI, only through something such as an EMR that has all of its data stored in the cloud? So typically, when we look at things like that, we want to make sure that we maintain records of any hardware or electronic media that touches EPHI in any way. And generally, as a best practice, we should list anything that any device or hardware, anything like that, that either creates, receives, maintains, or transmits EPHI, which in this case, transmitting of EPHI would be considered a device that accesses EPHI via an EMR that has cloud-based data.
Hmm. Yeah, I think that's a great point. Even if they never take any of that data from the HR and download it, onto a desktop, it still is being accessed through that device. And if you have think about it, I mean, I'm not an IT expert by any means, but your computer remembers things, right? So if you are going onto that website, unless they're completely deleting their browsing history at the end of each day, and even then, a hacker would 100% know how to uncover that, even if you deleted it. They might still be able to find a way into that EHR on that device, even if there's no actual EPHI on the desktop. And so I think, any device that's accessing it, even if it's a cloud based, I get that question a lot like, oh, everything's in the cloud. Great. You still need to track it. You need to track, here's our cloud server that we use that is, storing all of that information for us. All of that should be in that EPHI inventory list.
Great. I love that. We do have a couple other side questions that I've seen come through. One person says, my practice only has 6 people. Aren't I exempt from conducting an SRA?
No, not really. It is hard. I think, I have a lot of clients that are smaller. And so they find the SRA a little bit maybe overwhelming. At the end of the day, and I've even seen this in OCR enforcement actions, is they really don't differentiate between small to large practices. They still want to see that SRA is being conducted. You might find some things within the SRA that, given your size, maybe are a lot lower risk areas than a larger organization, but it is still worthwhile to go through it. And I would still think that the OCR would want you to conduct it.
Awesome. And then one other one that I saw come through was, how specific should my policies and procedures be? I have some, but they are pretty general in nature.
Yeah, I mean, I guess I would ask one of your staff members, if you read this policy, would you know what to do with it? Or is it too general? So the goal, obviously, of policies and procedures is to have them, and then, as I said, for them to be effective. And sometimes the only way you know if they're effective is to ask the people you're working with. Number one, if they know it exists. Number two, if they understand what it means. And number three, if they would know what to do in that given situation, just purely based on that information. So I would say some policies you might be able to get away with them being general, but I would err more on the side to them being company specific. So let's say you found a bunch of templates like online for policies. I would still go back through them and make sure they fit with the specifics of your organization. Jake, I don't know if you have anything to add to that, but that's what I would say.
Yeah, there's one thing I would add to that, and that's just because I'm in policies multiple
Yeah.
times a day, all day, every day. And
Yep.
that's simply that with policies, you kind of need to find that balance, because you don't want to have a policy that's so specific that you can't follow it, because that's really just as bad as not having a policy at all. So to
Mhm.
some degree, you do want there to be specificity, but you don't want it to be so specific that it's not achievable or something you can actually act on, because that really, again, it's just as bad as not having a policy at all, because at that point you're just proving negligence, really. Great, we have this process. Oh, well, did you follow it? Well, no, because we can't do all these things all the time. I mean, it's so I always err on the side of, I would rather have a more simplistic policy with some specifications that I can reasonably achieve and regularly follow, rather than something very robust, very detailed, that I'm in essence setting myself up to fail if I'm ever audited, because I can't actually do what my policy says I should be doing.
Yeah, for sure. And I think that's a excellent point, because I do think we run into that a lot with our clients. Your policies do not need to be, a single policy doesn't need to be 5 pages long. If it is, it needs to be scaled back. Then you have too much detail in there. You know, it needs to be digestible. You know, I even think about with the example of the notice of privacy practices, you know, we want that digestible to patients. Same with our staff. We want our policies to be able to be digestible and understood. And if they, for every policy, have to read 5 pages of details, 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 it's not going to happen. And you know that, I know that. I don't want to follow those policies either. It's too much. So making sure you keep the spirit of the policy in there, the letter of the law. Obviously, there's certain things that you can't just, you know, not have in a policy. But like Jake said, making sure it's actually something that can be followed is also important. All right. Anything else?
Nope, that's it.
Okay, perfect. Well, that's all I have for you all today. Thank you so much for attending this webinar. I know that Josie will be sending out a follow-up with the link of the recording. And of course, if you have any questions, feel free to reach out to any of us who are on the panel today, and we're happy to help you in your compliance efforts. So thank you.